Hi everyone, my name is Shaine Ansera. I'm the Co-Executive Director here with Indigenous Women Rising. Just getting on this Women's Health Week to remind you all to advocate for yourself, to speak up for yourself, and to fight for your right to bodily autonomy and your right to make informed decisions in your own care, including reproductive health care. I am a mom of 4. I have had a long journey in my own medical journey, in my own pathway to motherhood, in my own medical experiences outside of motherhood as well, just for my own general health, for my mental health. And in those experiences, I've learned that you will come upon times where it is hard to advocate for yourself, where you can feel defeated, where you feel as if your voice isn't loud enough. And one of my favorite quotes to remind myself of when I'm advocating for myself in the medical field is that even if your voice shakes, you should still use it. And in my journey to motherhood, I have had multiple incidences where I felt as if I was going unheard, as if I was going unsupported, and it felt very defeating to have those moments. I have 4 babies. My oldest is 8 and my youngest is 1.5 years. And in every one of those birth journeys and labor and delivery, I have had a variety of experiences. I have had everything from a emergency C-section, a scheduled C-section. I was in the hospital at the very start of COVID shutdown. I have had an attempted VBAC. A VBAC is a vaginal birth after cesarean section. And so I had an attempted VBAC that then led to a coerced C-section due to poor bedside manner and a failure of using my rights properly, advocating for my rights properly in that space, which led to quite a bit of birth trauma and feeling as if I had no choice but to have a C-section. And then my last was another planned C-section. In my journey through all of that, I have learned that it can be really difficult to continue using your voice. You will find a lot of pushback when using your voice. I have had some amazing support from Indigenous midwives, from hospital settings to other small clinic settings, and even in advocacy as I go through my own journey to become a doula. I have gone through multiple trainings for doula. There's not quite a catch-all certification for doulas across the nation, but I have done multiple doula trainings. I have gone to a multitude of various trainings on how to provide care and support for birthing parents and for lactating parents. And through all of that, it gave me a lot of knowledge on what was happening within my own body. It gave me a lot of access to the language that's used in hospital settings, that's used in birth settings, and ways that you can speak up for yourself, speak up for others. And even though I had all of that knowledge, even though I knew all of that, I still came upon a lot of medical professionals, ranging from nurses to midwives, receptionists even, all the way up to the head of the OBGYN department for UNM, which is University of New Mexico's hospital, in trying to fight for myself and trying to fight for my own birth plans and trying to make decisions that were best for me and my family in the time and the space that I was in. And I had what people would consider the right words. I had the right education. I knew what I was asking for. I knew what I wanted. And even when, with all of that knowledge and the proper language, I still would end up in situations where I was not listened to, where I was listened to, but then the medical professionals were apprehensive about whether or not I was telling the truth about what was happening within my own body, whether or not I knew what I was asking for, whether there was a lot of distrust on whether or not the decisions I was making were truly informed decisions, or whether or not I making an uninformed decision that they did not agree with. And it was really disheartening to go through all of that, knowing what I know about myself, what I know about my my own body, my own feelings, my own experiences, and having the knowledge that I have to speak up for myself and knowing what my rights are in hospital settings, that I was still denied what I feel was truly the ability to choose for myself. And it was very disheartening, and I've had to do a lot of work to work through that trauma, to work through that pain, that frustration, that even though if someone like me could have the knowledge, could have the language, could have the stamina to fight for yourself, to speak up for yourself over and over and over again, and I still felt defeated, how must people feel when they don't have that knowledge, when they don't have that education, when they don't have what they would consider the proper language to speak up for themselves in these hospital settings, to defend themselves against medical professionals who feel as if they're working in your best interest when you feel like it doesn't align with what you would like for yourself. In such a small time and space for labor and delivery. And as I grew, I found out how much it bleeds into other parts of women's health, other parts of an individual's health journey. I have been diagnosed with anxiety, depression, which then led to a diagnosis for postpartum depression after I had my children, and obsessive compulsive disorder, which is OCD, which was a diagnosis that also came after I had my children. And my mental health diagnoses happened and experiences were happening before I ever had children. And even in my younger years, I was told that I was wrong about what I was feeling, that it was normal for me to feel what I was feeling, and that what I was feeling was not within the proper scope of diagnoses for what they were willing to help me with. And it led me to go undiagnosed for many years. It led me to have to try and deal with my problems on my own without any sort of support or intervention. Finally, in my postpartum experiences with the Journeys Health Clinic, I was able to speak with a psychiatrist, speak with the psychologist, the talk therapists, work through what was necessary to help me combat these symptoms. We see oftentimes in a lot of our Native women how they are very good at masking. They are very good at hiding what they're feeling. They're very good at internalizing whatever they're going through and using that as a sort of coping mechanism, which can lead to a lack of intervention and a lack of support from outside resources. And I feel like that's because when we do speak up for ourselves, we are mistrusted. When we do speak up for ourselves, we are questioned further. We are pressed harder. We are forced to speak up over and over, and it can get very tiring and it can get very hard to do. And I have always been told that I'm a very strong-willed and strong-minded individual, but even with that sort of stamina, my voice starts to shake at the end. My voice gets tired, I get tired, and these are situations that should not be happening. And so I encourage all of you that it is really hard now to continue to be the one to fight for yourself, to fight for others, to speak up for yourself, to speak up for others, and to continue using your voice even when it shakes. Because the more that we do it, the more we normalize the fact that we know what is best for ourselves. We have the autonomy to speak for ourselves, to know our bodies best, to know our families best, and to use that knowledge and to use all of that experience that we have to really push to be listened to in medical spaces, and use all of that to guide our health journeys in what looks best for us. And that's really what bodily autonomy means for me, is using my voice and using my knowledge and using my lived experience to make decisions that make sense for me, decisions that make sense for my family, with the guidance and the input of medical professionals, without feeling like I am coerced or I am forced to make decisions that I am not comfortable with. And even if I am presented with information that makes me uncomfortable, exploring that information further and asking for additional support, asking for additional information, books, booklets, someone else to come explain it to you, to have another person available with you to help you understand, to help you digest the information that you're being given. And so I just want to get on here and let you all know that if you have ever gone through something like this, you are not alone. You are not the only one who has experienced it. Your experiences are valid. They may not always be the best, and we are often stigmatized, and we often don't talk about the ways in which the medical field is harmful to our people, but it is also often necessary to our people to continue and show up and be present and take up space in those fields so that you can truly say that you understand and you know what's happening with your body, and you can continue to make those decisions for yourself. And the more that we use our voice now, even if it shakes, the more that our children won't have to use their voices loudly, and we can speak for them, and future generations will be believed and be trusted